National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Dr. Jonathan Beatty, naturopathic doctor and a health expert here at nationalnutrition.ca. Today I want to tell you all a little bit about arteriosclerosis and atherosclerosis. These two words are often used interchangeably, and essentially they're to describe two different ways in which you can get narrowing and hardening of the arteries. Two of the different types you can get are arteriosclerosis, typically associated with calcium deposits in the arteries, whereas atherosclerosis, subtle difference, but typically associated with cholesterol deposits in the arteries. Now, I do want to make something very clear. Dietary cholesterol is not the cause behind the development of cholesterol plaques in the arteries. The cholesterol is there as a response molecule to inflammation. Anytime you have inflammation in the body, essentially your body sends out cholesterol as part of the repair process, and that's what actually leads to the development of the plaques. The same thing occurs actually with the calcium plaques. It's part of your body's response to the damage in the arteries. What you really want to focus on is not so much lowering the cholesterol as aggressively, but really looking at why is the cholesterol up in the first place? What's creating that underlying inflammation? Because that's going to be your real key to getting your arterial and atherosclerosis under control. So symptoms of this are very minimal if you have any at all. When the disease gets more severe, it can cause elevated blood pressure, changes in heart rate, but many times arterial and atherosclerosis are actually, there's no symptoms to them. That's why we often call heart disease the silent killer, is you don't feel anything wrong until it's too late. And typically how they become problematic is when a piece of this plaque breaks off and starts traveling through the artery, and when it gets to a narrow part in that artery, it gets stuck, or maybe it runs into another plaque and gets stuck. That occludes or blocks the artery, preventing new blood from getting to an area. When this happens in the heart, you end up with a heart attack. When this happens in the brain, you end up with a stroke. In both cases, what's happening is that blocked artery is preventing adequate oxygen and nutrition getting to those tissues, and the tissues begin to starve. If it happens to your heart, a portion of your heart starves, and that can cause it to fail, and of course cause a fatal heart attack. In the case of the brain, again, that clot can block off nutrition and oxygen to a part of the brain, causing that part of the brain to fail. And again, you can see a variety of symptoms with strokes. This is why, again, you'll see everything from slurred speech, blurry vision, headaches. There's a wide variety of ways in which a stroke can manifest, again, depending on the part of the brain that's been affected. So what are the causes behind arterial and atherosclerosis? One of the most common causes is dietary. Basically, one of the biggest problems we have is elevated blood sugars. So consuming too many refined sugars at once, consuming a diet high in, again, things like cola and soda pops, where you get really high doses of sugar, and these excessive sugars can actually bind to and damage the arteries. This then leads to an area where plaque development is going to occur. So having one soda once isn't necessarily going to be a problem, but when you have these things on a continued basis and you continue to produce this level of inflammation, that's going to cause plaque formation and ultimately going to lead to long-term cardiovascular disease. Other things that are associated, again, low vegetable intake. If you're not taking in the nutrients that your body needs to heal, essentially even the low-grade inflammation that's created on a daily basis can't be repaired. And when that happens, over time, that's how you get disease development, especially chronic disease. Every day your body creates a little bit of inflammation, and every day you need to take in enough antioxidants and enough anti-inflammatory nutrients to basically quell and repair that tissue damage. So again, increasing your fruit and vegetable intake, especially your leafy green vegetables, really great way to help manage cardiovascular disease. Some of the other things that you can do if you say already have cardiovascular disease or arterial or atherosclerosis, one of the things I recommend is taking something called coenzyme Q10, often shortened to CoQ10. The reason for this is CoQ10 is needed by every cell in the body to produce energy, but especially the heart. And what it allows is it allows the heart to beat stronger and a little bit slower using less oxygen. So what you actually get is an improved cardiac output. Basically, the heart is capable of delivering more oxygen to the cells and to the body while utilizing less oxygen itself. And so this reduces strain on the heart and can reduce the overall load, making it unlikely that you're, or less likely that you're going to end up having a heart attack or stroke. Additionally, I like something called carnitine. Carnitine is very important for helping to manage inflammation in the cardiovascular system, as well as managing how the heart muscle itself produces energy. And again, carnitine is needed by cells to uptake fat to be used as fuel, so it's very important for our bodies for fat and ultimately cholesterol management. Additionally, the B vitamins. One of the things I really like with B vitamins is that they're involved in almost every major repair pathway, so ensuring adequacy of these is very important. And last but not least is sort of the famous triad in heart disease, which is a combination of vitamin C, lysine, and proline. And the reason behind this little combination is that vitamin C, lysine, and proline are needed to make collagen, which is the tissue that makes your arteries elastic. And it's that elasticity, the ability of the artery to expand and contract, that prevents the likelihood of any type of blockage in that artery. So the more elastic the arteries are, even if there is a little arterial or atherosclerosis, it allows the artery to expand and let any blockages through and prevent any type of cardiovascular disease. So again, these are some of the things you can do to help manage arterial or atherosclerosis. If you have them, it doesn't mean it's the end of the road. As long as you make some lifestyle changes, I do believe cardiovascular disease, arterial and atherosclerosis are reversible conditions. It does take a lot of work and it takes time, but those positive lifestyle changes are the way to go to ensure that that happens. So I hope you've enjoyed this video. Check out more of our natural health videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.